Well, this year, more than 20,000 women in the U.S. will be diagnosed with ovarian cancer. Often the symptoms are different from patient to patient and go untreated until the cancer has spread. Two Works Fused Giselle Puente found genetic research is showing promise for both detecting and treating the deadly disease.
Cindy Hemby's life changed dramatically 10 years ago. Mysterious ailments went undiagnosed for months until finally she got the hard news. Ovarian cancer. Despite those ominous words, the wife and mother of a young daughter kept her chin up.
Thankfully for me, I'm a very optimistic person, so I just knew that I had no chance, unless I was a fighter.
What she needed to do was undergo surgery and 4 months of rigorous chemotherapy. She went into remission for 5 years, a key milestone for beating the disease for good. But months later, the cancer returned. Another surgery and 6 more treatments, remission again until 2017.
Once you've gone through the reoccurrence, you're just always aware that it could possibly happen again. You don't want to live your life in fear, but when you go to the doctor, you're not sure what that report's going to say.
More treatments and yet another 2.5 years of remission. But earlier this year, a CT scan showed the cancer risk was back. Still, Cindy's optimistic outlook hasn't waned.
So thankfully for me, all my reoccurrences have been very small in lymph nodes, so they've been contained.
And over the past 5 years, we've had some of the most remarkable breakthroughs that we've ever had in this disease. We understand the biology a lot better. We understand that ovarian cancer is more than just one disease. It's probably 20 different diseases.
Diseases that doctors now know have a genetic component, including BRCA or the BRCA gene, usually attributed with breast cancer patients.
Now we have therapies that are really directed towards treating patients that have BRCA or 1 or 2 mutations. And so that's probably been one of the biggest breakthroughs over the past decade.
He is optimistic that more funding and research will lead better treatment, including specific drug therapies.
And I think that over the next 10 to 20 years, that we'll see exponential rise in a number of different sort of targeted drugs that we can use against this disease.
That's news that helps patients like Cindy Hemby look forward to a brighter future.
I've lived 11 years with this, and I've lived a good life with it. And so, there's days that I wonder why, but most days I'm just glad that I'm still here and able to live with cancer.
Giselle Puente, 2 Works for You.